Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives of families of critically ill patients in intensive care, so that you can have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I've shown you why decision making in intensive care goes way beyond your critically ill loved one's diagnosis and prognosis. You can check out last week's blog if you're clicking on the link below this video. In this week's blog, I want to give you some insights about why families of critically ill patients in intensive care need to aim higher. You see, it's very easy to get bogged down, to become negative, even to become cynical if your critically ill loved one is in intensive care. After all, life can be extremely challenging during this often once-in-a-lifetime experience, whilst your loved one is critically ill in intensive care. This is particularly true if your critically ill loved one is going through one of the biggest challenges there are in intensive care, such as they are very unstable and in a very critical condition, or if they are in a life-threatening situation, or if they are in intensive care for long-term treatments and long-term stays, or if they are even approaching their end of life in intensive care. Those situations will be one of the biggest challenges in your lifetime, and those situations will test your beliefs, test your strength, your values, your patience, and they will also test how much peace of mind, power, control and influence you have during those challenging and difficult situations. After all, you and your family have been conditioned by society that hospitals and doctors know it all, and that they must know what's best. After all, society has told you that doctors and nurses are very smart people. They must have all the answers. And that's even more true when it comes to an environment like intensive care. But an often strictly academic view by the intensive care team leaves your and your family's needs out of the equation. And often the intensive care team has all the answers, but only from their perspective, by only and strictly viewing the issues from their perspective. And their perspective is more often than not purely academic. It's driven by the politics, by the dynamics in intensive care, by the intrigue, by the power play, and by the psychology in a busy and stressful intensive care unit. You also need to know and understand that by you buying into the mindset and views of the intensive care team in those difficult and challenging situations that I pointed out before, you and your family are limiting yourself to the point where you have no or limited peace of mind, control, power and influence. However the situation looks like that your critically ill loved one, you and your family are in, your biggest challenge is to make sure that you are forming an opinion and a view about the situation irrespective of what the intensive care team is telling you. You see, one of the things the intensive care team is not doing is empowering you in your decision-making capacity and in your decision-making ability. 99% of families of critically ill patients in intensive care have no control, no power and no influence, let alone peace of mind, and they never will, because they just take for face value whatever the intensive care team is telling them, and they are making a big mistake. 99% of families of critically ill patients in intensive care will never have peace of mind, control, power and influence, because they are not aiming high enough, and they are buying into the perceived power of the intensive care team. It makes me very angry and frustrated to find that families of critically ill patients are not aiming higher. And if I have learned one thing after more than 15 years of intensive care nursing in 3 different countries, it's that families need to stop being intimidated by the intensive care team. They need to stop thinking that they have no or not enough knowledge about intensive care, and the list could go on. I also put a link to a related article below this video. Read the article, How to Stop Being Intimidated by the Intensive Care Team. The bottom line is that you and your family need to aim higher in whatever you pursue for your critically ill loved one. And the reality is that if you do that, it often won't be in alignment with what the intensive care team wants or suggests. In fact, it'll often be contrary to what the intensive care team wants and suggests. I'll give you a few real-world examples here so that it really hits home for you. If your critically ill loved one has been in intensive care for 2 months and is not moving forward because of their ventilator dependency with tracheostomy, you can see that your loved one is depressed and has no quality of life. The intensive care team might suggest to you that a withdrawal or a limitation of treatment might be quote-unquote in the best interest of your critically ill loved one. So, in essence, the intensive care team is suggesting that it's quote-unquote in the best interest to let your loved one die. The intensive care team is not telling you that in some countries, for example, intensive home care services are a viable and genuine option for long-term ventilated adults and children with tracheostomy, such as intensive care at home. You can check that out at intensivecareathome.com.au. And the intensive care team also isn't telling you that they desperately need the bed your critically ill loved one is currently occupying, because they have other admissions waiting for that bed. The intensive care team also isn't telling you that they have deemed your loved one's case as non-financially viable and they therefore want to move on to other patients where they can make more money. The intensive care team hasn't told you that they think you and your family don't really understand what's going on. The intensive care team also hasn't told you that they think that you and your family don't really know and understand what's really going on, and they also think that you and your family haven't asked too many difficult questions. Therefore, the intensive care team thinks that it's easy for them to get what they want, because you and your family are perceived as weak, without control, power and influence. Your job is to educate yourself quickly, ask the right questions and have a vision for what you want for your critically ill loved one, irrespective of the intensive care team's view, because their view is often driven by politics and power play. Your job is to aim higher. I have more examples for you from the real world that will help you to aim higher. What if your critically ill loved one is approaching their end of life in intensive care? And what if the intensive care team has come back to you to tell you that they want to continue treatment because they think that your critically ill loved one has a chance to live? What they haven't told you is that your critically ill loved one is falling into a research category where the intensive care team can conduct some medical research or they can trial a drug and so forth. Medical research attracts 5, 6 or even 7-figure funding per year, and if your critically ill loved one is dying and you and your family don't really know what's going on, and if you don't know what's happening behind the scenes in intensive care, the intensive care team will have an easy time playing their games with you, your family and with your critically ill loved one. The reality is that I have seen many situations in intensive care where critically ill patients have been approaching the end of life, and the intensive care team suggested to continue treatment because they had research interests and they only prolonged the suffering of those patients. Those patients died anyway, but only after unnecessary and prolonged suffering, and after the intensive care team has quote-unquote sold families of critically ill patients in intensive care that continuing treatment would be quote-unquote in the best interest of the patient. Once again, your and your family's job is to educate yourself quickly, and then you need to aim higher. And you need to start asking for what you want. Don't worry about what the intensive care team wants or thinks. You know more than you think you do. Follow what you've learned here and you can't go wrong. Follow your gut feeling and you can't go wrong. If you think that the intensive care team has something to hide, they probably do. How can you have peace of mind, control, power and influence whilst your loved one is critically ill in intensive care? You get to that all-important feeling of peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, You learn quickly how to get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you'll also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How you can eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 killer tips and strategies helping you to get on the right path to peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's blog, and I'll see you again in another update next week. Make sure you also check out our Your Questions Answered section where we answer your questions, or send me an email to support@intensivecarehotline.com with your questions. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.